Newshub can reveal some nurses face tens of thousands of dollars in losses if new pay rates aren't backdated.
The Nurses Union says while new pay equity rates would stem the flow of nurses overseas, there's still plenty of work to do. Nick Trubridge reports.
A start, but still a ways to go, and near the top of the nursing union's lists, back pay on those big increases that'll see some earn over $10,000 more.
We will continue to prosecute our arguments for full back pay to 2019.
A nurse we spoke to calculated they'll miss out on $70,000 if their union's claim for back pay to December 2019 is unsuccessful. Junior colleagues they knew of stood to be $40,000 out of pocket, and that's just the tip of the iceberg.
I think it's around about 600 to 800 million at the moment, and that's probably going to increase. That's why we're in the employment court fighting.
The issue of back pay has become contentious between government and union. Newshub understands the union's position is that an agreement to back pay was formed during earlier collective bargaining. The Health Minister begs to differ.
There is no agreement on back pay to December 2019. That's an issue of dispute that the nurses organisation has brought to the employment court.
The Nurses Union says the new rates boosting pay for most nurses by more than 14% should stem departures overseas, but there's plenty more to do.
We want to see nurse-patient ratios introduced into hospitals and then spread out across the rest of the health system, including into aged residential care. Those ratios exist in Australia now.
As for pay, the Health Minister's adamant Te Whatu orders moved as quickly as possible, saying it only found out last week an Employment Relations Authority ruling on the matter was over a year away.
It's important that we do everything we can to get that money into nurses' pockets.
But just how much remains to be seen. Nick Trubridge, Newshub.